So, Dr. Glaser, you've really seen it all in the realm of health information technology. You've been with partners, you've been an ONC advisor, you've been with HIMSS, Chime. So, what has really kept your interest after all these years?
Well, I think for a lot of us in healthcare, there is the deep belief that we can make care better and that this is a very human and noble undertaking, because at the end of the day, all of us or someone we love is involved in the care system, often in very serious and distressing situations. So there's a desire to make it better for sort of deep moral humanitarian reasons. So at the end of the day, that's the driver. It's also a remarkably complicated field, and so there's an intellectual part of this, which is how do you put all the pieces together and make sure that they work out particularly well. And I think finally, a believer, as is probably everybody here at HIMSS, in the power of IT to affect enormous change. And so we're not there. I suspect in some ways we'll never be fully there. But how do we leverage the technology to help those who deliver care do a better job of delivering care, and those who are in the healthcare system as patients are more engaged and more effective at managing their health?
Now, what is the number one either kind of request or complaint from customers right now that they really want in an EHR system such as Siemens that you've seen?
Well, I think the sort of complaint or issue, and particularly when you deal with the C-suite or the clinical leadership or the board, is they are almost overwhelmed by the degree of change that is occurring. So they understand, as do we all, that there's a desire both in the U.S. but also globally to improve the quality and the efficiency of the safety of care. Not only the work that they do now within a hospital or physician practice, but increasingly to take on tasks they might not have had before, managing a population, coordinating care, et cetera. So these are all very different, very hard challenges for those who deliver care. And you couple that with a reimbursement environment that's trying to incent all of this, which is very complicated, highly evolutionary, unclear how effective it will be, and you combine that with new organizational models, accountable care organizations, patient-centered medical homes, and they see this extraordinary change coming their way, not always sure how to handle it, not always sure which investments to make or which approaches to take. So at the end of the day, I think the thing that they want from their vendor is to help me, if I were the CEO, make this transition and bring the technology that I obviously need, but do more than that. Help me think through process change, help me think through the new reimbursement, and help me effect a broad set of changes that I need to do in order to thrive in this new era of accountability. So it's less about specifically the HR, it's broadly as a partner who delivers product and services. Can you help me make this transition in as bump-free a way as possible, knowing it will not be trivial?
Now, what would you say is the top priority for Siemens right now? Is it data analytics, population health, interoperability? What's top of your mind?
Well, there's a number of things. I think probably number one is people begin to grapple with this challenge of managing a population of folks with various chronic diseases, but these are even populations of folks who, for example, having their hip replaced. So there's outpatient testing, the surgery, post-operative or rehab care, et cetera. So when you look at that challenge and you couple that with a reimbursement system that is increasingly going to be based on your quality, your efficiency, and this, that, or the other, the major focus of folks is a sort of constellation of systems, and it includes the health information exchange. How do I get the data flowing between those who deliver care? It includes the population management technology. How do I know where I am with the 5,000, 15,000 patients that I'm responsible for? And if I'm not in a good place with some of those patients, which should happen as a result of that, along with the analytics that say, am I in good shape or bad shape? Am I going to make money or lose money? Or my quality score is going up, down? Do I have certain providers who are less effective than others? So there's a constellation of products that sort of come together to do that. And it's increasingly coupled with a service element that says, do more than go, quote, just install the technology, help me think through organizational changes, process changes, et cetera. So that's where the focus is. I mean, there's still a lot of interest in the EHR, a lot of interest in the revenue cycle and do that, and a lot of interest in a number of departmental systems, but a lot, and you can see this at the show here today, is in the population health / analytics cluster.
Well, great. Thank you, Dr. Glaser, for
pleasure.
speaking with me.